So, good day everyone. So, my topic is all about nursing care of a family when a child has an infectious disorder. So, first we have the infectious disorder. What is infectious disorder? Well, it varies in their presentation. So, it is an illness due to a pathogen or its toxic product which arise through transmission from infected person or animals. And also, this is a disorder that caused by organisms such as um, parasites, bacteria, and fungi. So these are the most common signs and symptoms. We have the fever, malaise, myalgia, and arthagia. So fever, we all know on that. And then malaise, it is a discomfort, complete discomfort of the body. And then myalgia is a weakness of muscle. And then si arthagia is joint pain. So now let's proceed to the stages of infection. So after you get infected or after ka maanuhan sa infection, mag, you process through the stages. We have the incubation period, prodromal period, and convalescent period. So now let's proceed to incubation period. So this is incubation period is the time when na-expose ka to an infection agent to when you actually have the symptoms until na naka-symptoms. And then, during this time, ang microorganism mag-grow and also mag-multiply. And then, some people is dili dayon maka-feel og symptoms, depende siya sa agent or sa microorganism nga naka-infect sa imuha. So mag-base siya if unsa na agent ang nakapaak, and then or naka-infect rather. And then let's proceed to prodromal period. So si prodromal period is a time between the beginning of non-specific symptoms such as malaise, low-grade fever, fatigue, and arthagia. Tas dali na po mag-start si rashes and vomiting and diarrhea. Mag-start na siya rash sa iyang skin, and then magkalibangan na siya, and then mag-start na po siya vomiting. Kanina time is kanang ready na siya mo takod. Dili yung time na ano kayo mo takod si infection nga naa sa iya ha. Tapos during this time ang infection or ang virus or bacteria or organism nga niya is mag-start og replicate. And then due to replication, magka-worse na siya, magka-diarrhea, vomiting, and rashes. Tapos, let's proceed to convalescent period. Si convalescent period is, siya ang final stage. During this stage, ma-solve na ang symptoms, ma-resolve na ang iyahang mga pamati, and the person can maano na siya into normal function. And now, let's proceed to method by which infection spread. So, we have here the portal of exit, we have the blood. Means of transmission niya is arthropod vectors. These are katong mga insect like mga flies, mosquitoes, and then also ang portal of entry niya is injection into the bloodstream niya siya largo. And then prevention measure is decreasing exposure to vectors. Always naga-off lotion, and also just to prevent sa prevent mga flies, mga mosquito. Also have a blood sampling, transfusion. Prevention ani is careful handling of food sampling equipment, prescreening of blood or for organisms such as HIV or hepatitis B. And also another is respiratory secretion, airborne droplets ang iyang means of transmission. Vomits is ang means of transmission po niya is vomits. Vomits is katano siyang mga things or mga object that pwede maka-carry og kanang infection, like mga utensils, mga gipanggamit na sa mga tao na or gigamit nga na infection na magamit na to, so pwede ta ma-infect. And then we have the portal of entry ani is ang respiratory tract. Tapos prevention is wearing mask, and also droplet and airborne precautions. Always should protect ourselves from any mga droplet, mag-store siya wearing mask, and also most important is hand washing. And also another portal of exit is we have the feces. Feces are stool, so syempre hugaw. And then means of transmission is water, food, vomits, vectors such as flies. So water, syempre always choose what if atong giinom na water is giitihan sa langaw or sa gipuyan og kanang mosquito, so and then giinom nato, or our food giitihan og langaw, so it can be the means of transmission. And then also sa mga vomits na gamit ang mga things na ada infection. Another is the vectors such as flies, or as well what I've said, ang langaw ning ato sa imong pagkaon. So pwede ka ang langaw di ay kaning gikan to sa stool tapos ning patong sa imong pagkaon, tapos ang pagkaon gikaon na to, so it is a means of transmission. Ang portal of entry niya is gastrointestinal tract, and prevention measures is hand washing before eating, after using bathroom or after handling diapers. Yes. And then also from lesions, we have the means of transmission: direct contact with a soiled dressing. So and also a portal of entry niya is skin and our mucous membrane. And prevention is contact precautions always. And then self-screening for sexual contact, and also wearing always gloves from magkontact tag mga dressing. Kaya wata kabalo na siya lesions tapos naka skin to skin contact niya, di pwede ta may infection. Okay. So let's proceed to the viral infection. So upon viral infection, there are pathogens. Pathogens are microorganisms that can cause disease. Then there are 5 types of microorganisms: viruses, bacteria, rickettsias, helminths, and fungi. So now let's proceed what is viral infection. Viral infections with viral etiology are the most common infection diseases in children. Most viral infections require only symptomatic relief. So they are the smallest infection that are not visible with ordinary microscope. They're not cells, pero nag-contain sila og RNA or DNA, but dili pwede both, so one lang. And then also, viruses cannot replicate in their own. So they replicate nila by gina-invade nila ang bacteria, plant, and animal or human cells, and using biochemical products and of those cells to function, para ma-function. So now let's proceed to the viral exanthems. Viral exanthems are viruses are responsible for childhood exanthems or the skin rashes. So ma-identify na to sila ang skin rashes has sila specific symptoms and characteristic lesions and specific distribution or pattern to the rash that allows it to identify. So ma-identify na to siya through the lesions sa specific symptoms. So here are the sample secondary skin lesions and their characteristic. We have the macule, plaque, scale, scar. We have the tumor, the bulla, crust, erosion, vesicle, nodule, ulcer, atrophy, papule, wheal, and fissure. So those are the primary and secondary skin lesion and their characteristics. So makita na siya sa slides. So here are our common viral exanthems. First is we have the exanthem subitum or the Riciola infantum. So ang causative agent ani niya is a human herpes virus 6. So ang iyahang mode of transmission is still unknown, and then kanisa Riciola is a disease with fever pero followed by effervescence, which means na within 3 to 7 days mag-up and low ang iyahang fever. Tapos as I've said, ang iyahang mode of transmission is still unknown. And now let's proceed to rubella. Si rubella, ang iyahang causative agent is si rubella virus. Tapos ang iyahang mode of transmission is direct and indirect contact with droplets na siya. And now let's proceed to rubella or si measles. Ang causative agent niya ani is si measles virus. Measles is one of the most contagious viruses na with attack rate of 90% up until now. Tapos ang iyahang mode of transmission is direct contact with droplets or airborne spread. We also have the coptic spot or a small white spots with bluish white center on an erythematous background are seen in the oral mucus opposite to the buccal mucus before symptoms appear. So before symptoms appear, na siya gitawag na coptic spot na white small white spot niya siya na bluish, tapos makita na natin siya sa oral mucosa bitaw opposite sa to ang buccal mucosa. Na picture attached in the next. Tapos we We also have pictures from a typical rash of measles with children in the upper body. It is in the next slide. Tapos, we have the varicella or the chickenpox. So, we already know or nakadungog na tayo ng chickenpox. Tapos, ang causative agent ani is si varicella zoster virus or the VZV. Tapos, varicella is a common and highly contagious childhood infection caused by varicella zoster jod. Tapos, ang iyahang mode of transmission is spread by direct or indirect contact of saliva or often basal. So, mostly, we all know man nga kanang muna siya ang chickenpox. Katong, some people say na kita jud daw makaagi ani but thanks me kay wala pa jud ko kaagi ani but people say nga halos jud daw tanan tao na makaagi ani. Tapos mo ni siya nasa next slide na siya mga spot like nag-red and then sa whole body jud ni siya. And then now let's proceed to the herpes zoster. So herpes zoster is a virus that can become asymptomatically or symptomatically reactive. Pwede ka nakay symptoms ani or wala. Tapos kani si herpes zoster is a viral infection po ni siya. Then pwede siya magka-cause of outbreak of painful rash, bitaw sakit ang rash ani or blisters sa skin. So as we makita na siya sa picture like as a back sa sa child like ang ihang lesions like makita na to na red tapos painful kina siya. Tapos let's proceed to variola or the smallpox. Ang causative agent ani is smallpox virus. Ang yang mode of transmission is airborne transmission. Ang children nga na ay smallpox kay kanang mag-appear bitaw taas na ilang hilana then mag-also malaise kanang alipasa ang child tapos labad kay ang ulo tapos apa na siya magkasakit ang likod then ang mag-abdominal pain po siya na maglast mga 2 to 4 days. Na siya, smallpox is a serious illness. It's mildly rarer na siya pero serious yun na siya na illness. Tapos, so now let's proceed to erythema infectiosum or the fifth disease. Kani siya, ang iyang causative agent is si parvovirus B19. Kani siya is mag-start lang ni siya with mild lang bitang systemic symptoms niya which include fever, mugbo lang, like maggamay lang ang iyang, mag-high lang iyang fever pero dili kayo kanang taas. Tapos magka-headache and also malaise, alipasa lang siya. Present ni siya mga for 7 to 10 days before the child develop a slap cheek kanang appearance bitaw sa iyang cheeks. Murag kanang gisampal bitaw like slap cheek jud bitaw na mag-reddish ang iyang face na yan ana. Tapos the child is not contagious once the slap cheek develop. So here are the example pictures of the rubella or measles. Kani siya katong coptic spot on the oral mucous membrane. Sa oral mucous yun na siya guys ha, katong sa baba dapit. Tapos we have the rubella measles, katong rash of measles in the children's upper body, katong nagdot-dot na pula-pula na sa iyang upper body jud tanan. Tapos si chickenpox or the varicella dara like whole body jud siya mostly guys. And then next we have this sample picture of the herpes zoster katong sa likod sa baby, and then also si erythema infectiosum or F56 katong slap cheeks. More di siya gislapan ni guys. So now let's proceed to the non-polio enterovirus. So kani siya na virus, ang causative agent niya is member of the enteroviral family. So this virus causes tissue-specific cell destruction. So nag-destructure siya sa specific cell. Tapos, but some of the diseases caused by this group of viruses are related to the virus's host immune response. Depende on sa response sa imong immune system about ani na virus. Tapos, the skin manifestation are the result of the host response. Tapos, common manifestation of these viruses including non-specific viral infection or viral illness and skin infection, GI illness, eye infection, heart diseases, connected ani. Tapos we have numbered enterovirus and echovirus infection. So, the enteroviruses virus, which includes cosaic, echoviruses, and numbered enterovirus, often cause a non-specific illness with fever. So, so enterovirus is believed to be responsible for more serious form of acute flaccid myelitis that can cause limb weakness or paralysis in previously healthy children. Pwede kag makalit ng paralyze kanina siya. Kay iyahang often cause is non-specific illness with fever. So iyahang ano biya diri case ano man na sila si non-polio enterovirus is kanang iyang ang viruses that ang specific cell mang-destruct sila sa specific cell. We also have the Coxsackie virus infection. Coxsackie virus A6 and A16 are associated with hand, foot, and mouth disease with distinctive erythematous papules mainly on the hand and feet, but occasionally on the buttocks and oral ulcer in the pharynx. So they mostly appeared magka-lesion sila sa mouth, and then sa hand magka-daghan kay sila lesions. Tapos we also have the poliovirus infection, the poliomyelitis or infantile paralysis. Tapos ang iyang causative virus agent ani is si poliovirus. Tapos polio is still present globally, naghihapon ang polio karon. And then ang iyahang mode of transmission ani is respiratory secretions and also sa feces or the stool. And also, there is no antiviral known to treat a form of polio even nowadays. And now, so let's proceed the viral infection of the integumentary system. So, viral infection of the skin, it includes infection, herpes infections, and warts or the verrucae. So, first is to have the herpes virus infection or the herpes virus. These infections are common, so potentially life-threatening din siya and are caused by herpes virus 1 and herpes virus 2. They can be found as primarily mucocutaneous infection, an acute infection of the ganglia or a latent form that is reactivated from previous infection or the chronic recurrent. So, kani siya is ang iyahang causative agent ani is si herpes virus type 1 and type 2. Tapos ang iyang mode of transmission is direct contact with person with active lesion or persons shielding the virus asymptomatically. So some form of this herpes virus manggod is pwede siya asymptomatic. So ang iyahang mode of transmission is direct contact. So natakabalo is someone is infected na di ay tapos nagka-skin contact so pwede ta ma-affect. And then we also have the verrucae or warts, which are members of virus family of Papillomaviridae. Si papillomavirus most commonly cause a skin manifestation but can cause pwede na siya both genital and oral malignancies. Tapos, there are over 100 types of kanang HPVs, so which are members of virus family. So, warts can manifest in any part of the body. Pwede siya sa hand, sa face, and any. So, kanang ang pagka magka-warts ang kamot or ang face, generally, ma-remove sila with if the patient or the parent is concerned about their appearance. So, pag dili na siya, pag okay na siya sa iyang face, nga na siya wart, or okay siya sa iyang body, nga na then you can. Pero pag dili, and then concern siya and also with consent, pwede na siya tangtangon. And now, let's proceed to the virus causing central nervous system diseases. So, even though mag-ask unsa na virus ang magka-cause or CNS, is the first virus that come up in my mind is rabies jud siya. And then rabies, as a human, rabies is a serious and distressing disease that poses a threat to public health. The Lyssavirus genus, which includes the rabies virus, cause fatal acute encephalitis. Si si encephalitis, it is an inflammation of the tissue, active tissue sa brain, caused by an infection or autoimmune response. Tapos, we also have another viral infection. So, here are other infection transmitted by animal vectors. We have the hantavirus pulmonary syndrome infection. So, si hantavirus is a member ni siya sa arbovirus group. It is transmitted to human by inhaling. Ma-inhale na to ang aerosols or dust particle na contaminated and also nag-contain of hantavirus. And also we have the Zika virus disease. Si Zika virus is ano ni siya? Katong yellow fever mosquito, kato siya ang one of the world most deadly animals kasing a yellow fever. Katong Zika virus, mao ni siya. Katong dengue and viral and chikungunya viral infection. So, the mosquito lay their eggs in their containers that can hold water. So, mao yun So, mosquitoes kan kuan man makadagan sila in the water. Next is the West Nile virus disease. It is the most common arboviral disease sa United States. Tapos, the transmission of arbovirus occurs between arthropods and their host, which are small or mammals or birds. So, pwede na siya through kanang mga insect, like sa mosquito, pwede siya sa mosquito, sa lice, pwede siya or sa flies. And then, we also have other viral infection. We have mumps, Epstein-Barr infectious, mononucleosis, and also the COVID-19. Si mumps is, we all know, bayuok. And then, ang yang causative virus is si mumps virus. Tapos, ang mode of transmission niya is direct contact with respiratory droplets through the respiratory droplets. Na siya picture, next, attach, sample. And then also, some of us siguro nakaagi na og mumps. Mumps cause parotid gland enlarged. So, manang magdako ang ato ang kaning sa pangadapit because of parotid gland mag-enlarge siya. Tapos, we also have the Epstein-Barr infectious mononucleosis. Ang iyahang infectious mononucleosis is the most common manifestation. We also have the Epstein-Barr infection mononucleosis. Tapos, ang iyang causative agent is si Epstein-Barr virus. Tapos, ang symptoms niya includes fever, cervical adenopathy, or enlargement of the cervical nodes. Tapos, also, pa siya chills and malaise. Tapos, here are the sample picture. Nana siya sample picture sa the next slide. Makita nyo dito. Katong the appearance of tonsils in a child with infectious mononucleosis. Appearance mo ni siya. Meron siyang namaga, tapos nagka-white bitaw. Tapos sakit ka siya. And then, ang lawas sa patient is like alipasa, and then sige siya ginapanugno na time. We also have the COVID-19, which is familiar ka sa tua. It is a novel member of a enveloped RNA coronavirus. Tapos, regular coronavirus is prevalent in the population and causes the upper respiratory infection or the common cold. So, mostly symptoms na to. And then, the virus enters the cells via receptors called angiotensin converting enzyme, CAs. Tapos, mag-replicate niya siya inside the cell of cytoplasm. Tapos, siya. And then kanin na virus can cause an excessive bitaw immune reaction. Bantog mahina itong lawas or ang lawas katong nagka-COVID-19. Mag-lead to siya into causing tissue damage in adults as well as inflammation and increased risk of clotting. Okay. Magkahinay magud ang immune system ato. So, mo ni siya ang example picture of katong the parotid gland is located just in front of the ear. Kato siya si mumps. And then, the appearance of tonsils in a child with infectious mononucleosis. Ano siya, example picture. So now, let's proceed to bacterial infection. So, bacterial infection are independent living organism with a nucleus that contains both DNA and RNA. So, muna siyang katong nagcontain na og DNA and RNA. Tapos, they reproduce by fission, in which one cell enlarges and duplicate itself, and then divides into two equal parts. So, muna na siya kay magka-duplicate na siya in her own self. Tapos, we have the streptococcal disease streptococci, which is a gram-positive organism that are normally found in the respiratory, alimentary, and female genital tract. So, we have the scarlet fever. So, the scarlet fever occurs mostly commonly in the school age, peaking in the 7 to 8 years old of age. So, and this is the highest temperature climate, and the disease occurs usually in the late autumn, winter, and early spring. So, muna siya. Tapos, we have also empatigo. Natay picture sa gilid, kaya siya empatigo. Si empatigo is, siya, common in child ages 2 to 5 and the most common of the bacterial skin infection. So, infection involves top layer of or epidermal layer of the skin and generally characterized by honey-colored crust. Kanang siyang nana, di ba mostly sa mga bata makita nato na yung mga inani? Yes, it is a bacterial infection. Tapos, yung color is mura siya kanang honey, nga mura siya nana. And then, we also have the cat scratch disease. This occurs mostly in preschool children because children that age tend to play roughly with cats. So, cats kanang masigidula og cats, then ilang ko gusuguson. At the time, mag-contract sila sa disease, the cat does not appear ill. The initial skin lesion is papule or pustule, katong iyahang mag-appear ang siyang lesion is nato sa katong mga types of lesion nato makita. Tapos, let's proceed to the staphylococcal infection. The staphylococcal infection are normally found in the skin surface, therefore, they are commonly like an organism involved in the skin infection. We have the folliculitis. Si folliculitis occurs when the hair follicles are ma-inflame. Tapos, we have the furonclosis or carbonculosis is it is a furuncle infection, staphylococcal infection of a single hair follicle. So, single hair ni siya. And carbuncle has multiple hair follicles with opening. A single or multiple yellow pustule forms of the site. There is a localized redness, pain, sakit na siya, and also edema surrounding sa skin. Tapos, we also have the cellulitis. Inflammation ni siya of the subcutaneous layer of the skin and can extend to dermis. So, spread ni siya warmth, magka-tenderness ni siya, and erythema with borders are not distinct. It can occur anywhere of the body. Pwede siya bisan aha. Tapos, we also have the methicillin resistant Staphylococcus aureus. Tapos, it is a strain of Staphylococcus that cause skin infection and become resistant to common broad-spectrum antibiotics. When infection occurs in a healthcare setting, it is referred to a healthcare-related na dayon. Kay man siya. Tapos, we also have the scald skin disease. Scald skin syndrome or retard disease is a staphylococcal infection seen in infants. Newborn develop rough texture skin and general erythema, especially in the areas of encountered friction. So, yes. Tapos, next is we also have another bacteria infection. We have the aureus and streptococcal infection are the most common bacterial infection in children. But other bacteria are also responsible for infection in pediatric parents. So, we have the diphtheria. Si diphtheria, it is a potentially fatal but rare illness due to immunization. Kaya naman tayo, mga immunization ron paganak. And then we also have a whooping cough or the pertussis. So, ano siya? Si pertussis man has been increasing not just in the United States, kay sa book is nag-increase man si pertussis sa United States, but also here in our country. So, the disease can manifest as mild tetanus, mild cough. So, ubo-ubo siya, tapos dugay. And then, we also have the anthrax. Si Si anthrax is we have the skin or cutaneous anthrax. So this is the most common form of infection sa human. Tapos the case fatality rate is less than 2% with antimicrobial therapy. Initially, there is localized ka nang mag-itchy ni kay siya. There's a painless papule that turns into the vesicle that enlarges and ulcerates. Pwede siya mudako ni siya. Tapos, we also have the tetanus or lockjaw. Cause of agent is C. tetani. Tapos, si tetanus occurs worldwide and causes a acute spastic paralytic illness caused by a neurotoxin produced by Clostridium. And then, ang first yun naman to manotice sa symptoms of generalized tetanus is stiff neck and stiffness of neck and sa jaw. Though tetanus, Lyme disease is the most common thick bone illness. Si Lyme disease is naapod siya ka ng bitaw. Ay daw naman ni sila tanan katong stages of infection. So, as well as si Lyme disease, naapod siya katong 3 stages of kanang infection. Now, let's proceed to the rickettsial diseases. So rickets are organisms that resemble viruses both in size and their inability to reproduce except inside the cell of the host organism. They reproduce by fission as a bacteria do. Like bacteria, they are a complete organism containing both RNA and DNA. So, si bacteria is naman siya RNA and DNA. Dili pareha sa viral na contain lang sa it's either RNA or DNA. So, we have first the Rocky Mountain Spotted Fever. Siyempre, ang cause of agent niya is Rickettsia rickettsii. Tapos, this is a potentially fatal illness transmitted mostly by the American dog tick, but it also be transmitted by the brown dog tick. Tapos, ang initial presentation is not specific and includes fever, chills, headache, inana, magka-malaise, and also pwede siya magka-nausea, vomiting, and myalgia. Tapos, here is the sample picture of the Rocky Mountain Spotted Fever. Magkainana yung hands. Look at the hands. Magka-rash na mga dot-dot bitaw. Next is we have the psittacosis. It is a respiratory disease transmitted to children through ma-inhale bitaw of aerosolized excrement or respiratory secretion from the eyes or the beaks of birds that are infected with the bacteria tapos ma-inhale bitaw. And also we have the parasitic infection. See, parasites are organisms that lived on and obtained their food supply from the other organism. And now, here are the parasitic infection. First is we have the helminthic infection. Si helminths are pathogenic or parasitic worms. They are then transmitted to the oral cavity by contaminated foods or hands. So, ano na siya mostly ang maano sa mga bata na mostly palaboy. Just like kay makuha man nila sa mga food sa hands tapos kanang mga bata na daily nagahugas sa kamot before eating. So, we have the roundworms, the hookworms, enterobiasis, or the pinworms. Si roundworms is or the Ascar lumbricoids are generally asymptomatic infection, but extensive na gali ang parasites load. Magkaan na siya, malnourished na siya, magka-malnutrition and GI symptoms result na dayon ang children. And we also have the hookworm. Si hookworm infection tend to be asymptomatic and more common in children living in tropical climates with poor sanitation. This is what I'm telling katong mga bata nga dili mostly nagahinaw sa mga pagkaon, di ba? O yung mabantay to sila na mga malnourished. Tapos we also have the enterobiasis or the pinworms. These are small whitish sila, and then thread-like worms that live in the cecum. So, cecum. After indigestion of the egg, the mature worms develop over period of 2 months in the cecum. So, ito na sila. The worms are large enough that they can be seen if the child buttocks are separated. Sa lubot na siya dapit. Tapos, as we have the protozoan infection. Protozoa are an unicellular organism. They absorb fluid through their cell membrane and can move from place to place by pseudopod, flagella, or cilia action. So, they are most pathogenic na siya sa GI, genitourinary, and circulatory system. So, ang ubang protozoa, mag-reproduce sila by simple binary fission lang, where other forms have complex life cycles. Life cycle lang. They have ability to form cysts or surround themselves with a membrane, which makes them resistant sa destruction, which makes them strong. And naa siya, we have the Giardiasis. Si Giardiasis lambia, muna siya is the most common intestinal parasitic infection. Tapos, with transmission occurring from groundwater contamination and untreated surfaces that are contaminated. So, mga water places nga takabalo na contaminated ay. Tapos, let's proceed. We also have the fungal infection. The fungal infection are larger than bacteria. Some are unicellular, yes, but generally they are multicellular or molds. Tapos, kani sila is invaded, subcutaneous mycosis invade the skin. Gina-invade nila ang skin, subcutaneous tissues, and bone. So, infections usually occur from introduction of the fungi into the wound. Sa wound yun sila mostly. So, superficial mycosis involved only in hair, skin, or nail. Anya, ang mga baby, mga bata, children, karon kaya di naman kabalong hinaw, ang mga kukutag as kaayo. So, they tend na magsugod ang fungi. Tapos, here is the example. We also have here the super fungal infection. Naa siya 4 superficial fungal infection seen frequently in children. We have the tinea croris, pedis, captifis, and corporis. Naa diri ang sample. We also have here tinea corposis, kanisha si tinea corposis. Si tinea corposis is a artificial mildly erythematous ring-like infection of the epidermal layer of the skin, characterized by slightly scary central cleaning and the raised papillary borders. Nawa siya, circularized na siya. Tapos, and lastly is we have the candidiasis. Si candidiasis is a yeast that reproduced by budding and in a well and causes oral and skin monenial or candida infection. It is the common normal flora of the vagina and infant acquired during the birth process. So, na siya lang tawa. There na siya. This is the monelial or the candidiasis diaper rash. So, baby bitaw, like na gumagarash man. Intense red color of the rash and satellite lesion gid siya. Skin infection are treated with antifungal drugs man. So, matreated na siya with some antifungal drugs. Yes. And that would be all. Thank you.